Blood is the fluid of life, and without adequate quantity and supply, the human body cannot function effectively. This is why blood banks play a vital role in Nigeria's healthcare system, providing life-saving blood transfusions to patients in need. With a high demand for blood, especially for surgeries and emergency cases, blood banks help bridge the gap. So, on this edition of Frontiers, we will be taking a look at saving lives through safe and efficient national blood systems. My name is Frama Pani, and our guest is Dr. Sale Yogoda, Director General, National Blood Service Commission, NBSC. Glad to have you join us on the program.
Thank you very much. It's a pleasure being here.
The program continues shortly. Once more, you're welcome to the program Frontiers.
Thank you very much.
Now let's get into the business of the day. What is the current state of national blood supply, and there are many concerns about shortages or contamination. If there are, share with us your thoughts.
Okay. Thank you very much once again. When you are talking about the current status, I would say, like you all know, blood is generally a scarce commodity, even in the developed countries, talk less of our own situation in Nigeria. So generally blood is required for, according to the WHO, every minute somebody needs blood. Every minute somebody somewhere needs blood.
Wow.
So in this country we are faced with a lot of challenges. There is one shortage of the blood across all the hospitals and states in the country. So currently we have a big gap between the supply and the demand of the population, because by the WHO at least you need up to 1/3 of your population to be donating blood regularly for you to meet up with the requirement. So if you look at our data, I can say the supply of blood is very, very low. But that's why we are here to encourage people to come out and donate blood voluntarily. Because currently in Nigeria, there are basically 3 types of blood donation that we have. One is those that come out voluntarily to donate blood. Then the second one are those that we usually use in this country. We call them family replacement donors. And then the third category, which we don't usually encourage, are the commercial donors or paid donors. So if you look at it, the best category of blood, that's the safest that you can get, is the one that is donated voluntarily at your own will, without thinking of any gain from either in terms of stipends that will be paid to you, or maybe your family is sick, you want to help that person. So the best form of blood that we need is the voluntary one. So based on our own records, those that are donating blood voluntarily are very, very low. In fact, they are less than 10% of what we collect, even though we have a huge deficit. Like I told you before, if you look at the population of the country now, we are more than 200 million. And you are talking about at least 1/3 of the population to be donating blood for you to get the required demand, to meet up with the demands of the community. So you will see that we need not less than 60 million units of blood annually to meet up with the requirement. So this, I can say, is very, very huge. There is very, very huge gap between what we have on ground and what we require to meet up with the demand of the population.
Okay. Now, how is the Commission, addressing the issue of blood safety and screening for infectious diseases?
So as a body, the Commission was actually established in 2021, even though the National Blood Service has been in existence for almost about 18 to 20 years, since 2005, 2006, when it was first established as a department under the Federal Ministry of Health. So the Commission was signed into law in 2021. So as a Commission, what we are doing is we are giving the mandate of regulating bloods, all the blood establishments in the country, to ensure that each and every person that is involved in the supply chain of blood is meeting off with the minimum standards of screening those blood, because we know that the minimum standard is what we call ELISA machine. So for testing the blood for infections, and currently in Nigeria we test for 4 major infections that are bloodborne. We call them transfusion transmissible infections. So these include HIV, that's HIV 1 and 2. We have hepatitis B, hepatitis C, and syphilis. So these are the minimum that you need to screen according to WHO.
And doctor, you had earlier mentioned, the problem of shortage of blood worldwide, and you said Nigeria is not an exception. What initiative have been implemented, to increase or encourage blood donation rates, particularly among underrepresented groups?
Yeah, what we are doing is, as the commission, is we are engaging, like I told you earlier, we are engaging the NYSC in order to, the target is basically youth population, because they are the ones that once you catch them young, so you will not encourage them to imbibe that habit of donating blood regularly, because by the standard you are supposed to donate blood up to 3 times in a year. So there are a lot of programs that we are doing. Like, for example, one of them is the engagement of the NYSC through their CD, that's community development programs that they do. Right from the camp, we go to the camp. In each of the states of the country, we go there, educate them on the importance of the blood donation, and also try and encourage them to be regular donors. So apart from meeting the NYSC, we are also going to school. There are so many school programs that we are doing. We are currently collaborating with NIMSA, the NANS, and various other school organizations, so that they usually form those blood donor club in their institutions. One of the notable one is the Club 25. The essence of Club 25 is to ensure that younger generation are encouraged, and also are encouraged to join the bandwagon of voluntary blood donors. So the program is designed in such a way that they start very early at the age of 17 or 18, and then they'll continue, so that by the time they will reach 25 years, they must have voluntarily donated up to 25 units of blood.
Wow.
So that's what we call Club 25. And if you look at the age gap between 17, 18 to 25, usually is the age for where they are usually in the higher institutions. So we are targeting those population, and locally there are so many youths that are coming out now to join those particular programs that we are doing. So in addition, we are also partnering with some religious organizations like the Supreme Council of the Muslim Islamic Affairs, the CAN, as well as MSS, Muslim Muslim Students Society. So all these religious organizations, we are also reaching out to them and signing MOU with them and make sure that they encourage. We also go there to the mosques and to the churches to talk to people to make sure that they have that habit. And one of the major importance of being a voluntary donor is that you are assured of getting free medical checkup regularly.
Wow.
Yes, because whenever you go to donate blood, the first and foremost you will be asked about your lifestyle. Are you involved in any risky lifestyle? No. Do you take drugs? No. We all defile those people. So if you are a voluntary donor, so you'll be scared, like, let me not go back. And they now disqualify you from donating. So most of them, what we realize is once they start, they tend to maintain a healthy lifestyle. So by the time you go to donate blood, and like I said earlier, you'll be asked generally about your well-being, and then we'll check your weight, we'll check your blood pressure, we'll check your, we'll also screen you for all the infections, HIV, hepatitis B and C, and syphilis. All this one, if you go to the hospital ordinarily to do them, it will cost you not less than 20,000 naira to do it. But we can give you that free. So by being a blood donor, it's actually offering you like free medical checkup regularly. Just imagine you go to the hospital and you'll be screened and you will be assessed for your health well-being 3 times in a year. So it's quite a very good initiative for them. And also, it's kind of give you self-esteem, because you will come out and know that you are doing something for the community. As in, you don't know the person that will use the blood. It can be anybody. It can be anybody. So by just giving that blood, you are helping somebody that is in their needs. So these are some of the advantages of being a voluntary donor. That's why we are encouraging people to come out and donate blood regularly.
What is the Commission doing, or what are some of the measures put in place by the Commission to ensure equitable distribution of blood products to healthcare facilities and patients in need?
We have 6 regional offices in each of the geopolitical zones. We have one for the northeast, we have in Maiduguri. For northwest is in Kaduna. For north central in Jos. And then for north central in Jos, south is in Benin, Edo State, southeast in Owerri, Imo State, and then we have the office of southwest in Ibadan, Oyo State. So in addition to these 6 centers, we also have 2 offices, one in Abuja, Operation Center, and then the other one in Port Harcourt for the Armed Forces Blood Service. So if you put those ones, we have 8 regional centers. And in addition, we also have about 9 state offices, because the Act mandated us, in addition to establishing the blood service on our own, we are also required to encourage state governments to establish their own blood service. And this will now come and partner with them. So many states have indicated interest, and so far now we have about 9 on board. One of the first that was established is that of our Lagos State. I must say Lagos State is doing very, very wonderful in terms of our blood transfusion, because over the last 20 years they have been doing the same thing. They have established their own Lagos State blood service, which has been in existence for about 20 years now. So by those centers, we tend to, those regional centers are supposed to regulate and ensure distribution to all the states within their own catchment areas. We have a program that we call hospital linkage, where a hospital that is in need of blood, rather than sending the patient, will just directly reach out to the center nearest to him, so that he will just go in and collect blood from those centers. And also to ensure equitable distribution, that part of our own mandate is to establish the National Reserve, Strategic Reserve for blood. This National Strategic Reserve, we are supposed to get at least 1 million units of blood in our reserve. And this is the minimum that we'll keep in case of emergencies, in case of pandemic, like we have all seen what happened during COVID pandemic in the whole world, where there were a lot of shortage of blood, and then also people are not coming out to donate because of so many fear that was going on in the country and in the world at large. So by using those programs, we are trying to ensure to each and every corner of the country. And also, in addition, we are partnering with the National Emergency Medical Service. This National Emergency Medical Service is a program of the Federal Ministry of Health that ensures easy access to medical service for individuals that are in their need during emergencies. For example, it can either be a traffic accident, or the common one is the obstetric hemorrhage. This obstetric hemorrhage consumes a lot of blood, like I always say. So by partnering with the National Emergency Service, they are mandated to go to all the, in fact, as low as the local government areas that can reach them. So we are trying to partner with them to ensure that blood is available for them. At any point in time, wherever there is accident, they can reach out to us easily, and we will now make sure that the blood is available for them.
Okay. All right.
Thank you.
Thank you so much. We'll take a short break here. We will be back in a moment. Don't go away. welcome back. Now let's pick up the discussion with Dr. Saleh. Now, Dr. tell us, what is the role of the Commission, or what is the role the Commission is playing in promoting research and development of, or in the field of blood transfusion in medicine?
Anywhere, any system, any program, if there is no research, it will not progress. And you can only do research when you have good data available and the services are there. So in terms of research, there are so many untapped resources that are lying there in the blood service. For example, recently, 2 months ago, we signed an MOU with the Dutch government in order to assist us to tap into autologous blood transfusion. By autologous blood transfusion means the patient, the individual will now be transfused his own blood. Yes, his own blood. For example, if you are going for a surgery, one is going for a surgery, so there is one that will now go to the hospital, will assess him, take his blood and keep for him. So that during surgery, the blood will be given back to him if he needs it. In terms of road traffic accident, or during surgery, or during childbirth, there are so many issues that happen that one can lose a lot of blood. So this blood that is going out can be salvaged by a system. It's a very simple technology. So once the blood is salvaged from the individual that is losing that blood, ordinarily the blood will have gone through the drain. So, but we now salvage the blood, wash it, and then transfuse back to the individual. This is very important, more especially for some individuals that don't accept blood transfusion from somebody, either because of cultural reasons or because of religious beliefs. So we have a lot of challenges in that aspect. So we now signed an MOU with the Dutch government through a company called HemoCure. So they will now try and test that system. They have a very simple filters that we can use. So this pilot study is being conducted in University of Abuja Teaching Hospital in Gwagwalade here in Abuja, and then University of Calabar Teaching Hospital. So these two programs, once we do it for a year, and we now look at the results, if it's helpful, if it's encouraging, then we now go ahead to implement it nationwide. So the other ones are, we are also looking at how to fractionate those blood that we are collecting. You know, blood as a whole has so many components. So there are so many things that can be used from the blood. We can drive albumin from it. We can drive so many medicinal products from the blood. Even the plasma, when you separate it, the supernatant usually, you see it like just clear fluid, and then the rest, red blood cell will go down. So even those plasma, we can use it for medicinal purposes in another individual. So in essence, 1 unit of blood can be used for, ideally, for several individuals. But because of costs and other logistic problems that we have, we don't usually tap into that aspect. So that's why we are now partnering with so many some multinational companies to come in and look at, we want to research and see, okay, can this program be feasible in the country? Can we afford it? So we are trying now to see if it's feasible in the country, then we can now tap into that aspect. So the importance of research in blood transfusion cannot be overemphasized. There are so many advantages of those data, and publish it in our journals, in the medical journals, and then they will now see the result and see reason why they will come in to the country, because blood is very expensive and it's scarce commodity. So once they come in, we'll be able to subsidize for individuals that are in their needs of the blood.
You mentioned collaboration and sign an MOU with some multinational companies. I want to talk more on that, but this time around, what is the collaboration like, between the Commission and some of these international organizations, particularly in the aspect of addressing the global challenge of safety of blood and making it available?
For example, we are talking with one company now.
Okay.
Current cost of screening blood because of dollar naira exchange rate now has gone up.
Wow.
Even beyond what we charge individuals when they collect a unit of blood. So it has gone up to as high as 15,000 naira because of the exchange rate to screen 1 unit of blood for these 4 infections that I mentioned earlier. So what we are trying to do now is to collaborate with some of these companies. Okay, come to Nigeria, look at our situation. We can't afford to continue paying that huge amount of money because currently for us, the money we are charging cannot even cover for the screening of the blood. So they have agreed they will come. And they have also agreed that they will look at it and come up with a model for Africa and also for Nigeria in particular, so that they can subsidize the cost. So this can only be done if we are able to convince people to come out and donate, because once you have number, then definitely the cost will go down. Because for example now, on our own platform for the National Blood Service Commission, we collect less than 30,000 units of blood annually. While I know one hospital can collect more than that. Yes, currently. So what we are trying to do is to link all the hospitals in the country to our own database so that we know what they are doing. In addition to supervising and regulating their practices, we will also look at the number of units they are collecting, number of blood units they are screening, and then we now harmonize all those things and establish regional screening centers for all the hospitals in the country. For example, now in Abuja, we can have 1 or 2 centers that can screen blood for all the hospitals. Wow. It can be done, yes, it can be done. Okay. Because with those machines, one person within 4 hours, 5 hours, can screen more than 600 units of blood with the machines. But this can only be achieved if we have a number. If individuals come out to donate blood regularly, and then if hospitals and other health facilities agreed to key in to the system, because very soon we are going to launch an electronic system where all the hospitals will be linked together, and we can look at the data and say, okay, this is the number of bloods that we can screen in the country. With that, we can be able to lower the cost of screening bloods.
All right. Dr. Sale, it's been very interesting and very enlightening speaking with you. More questions, but for time, we've got our discussion here. Thank you so much for coming on Frontiers and sharing your thoughts with us.
It's a pleasure having you. Thank you.
And on this episode of Frontiers, we have been talking with Dr. Sale Yuguda, the Director General of National Blood Service Commission, NBSC. Thank you for being a part of the program. My name is Frama Payne. Remain blessed.